Utility of Rasayana in Clinical Practice, organized by Ayush Federation of India, Karkala. Before starting our session, we'll seek a blessing. So I would like to call Dr. Prithvi for prayer. Over to you, Prithvi.
गजमुखने जयतु गणनाथने गजमुखने जयतु गणनाथने त्रिजगवन्द्य शिवजातने त्रिजगवन्द्य शिवजातने गजमुखने जयतु गणनाथने शेषोद्धरवर पाशाङ्कुशधर पाशरहित रवितेजने पाशरहित रवितेजने गजमुखने जयतु गणनाथने मङ्गलमहिमने तुङ्गसुदेहने मङ्गलमहिमने तुङ्गसुदेहने गङ्गाधर वरबालने गङ्गाधर वरबालने गजमुखने जयतु गणनाथने गजमुखने जयतु गणनाथने त्रिजगवन्द्य शिवजातने त्रिजगवन्द्य शिवजातने गजमुखने जयतु गणनाथने गजमुखने जयतु गजमुखने जयतु गजमुखने जयतु गणनाथने. Thank you.
Thank you, Prithvi. Now I would like to call Dr. Ravi Prasad Hegde, PG Dean, Advanced Ayurveda Medical College, Modubidre, to welcome the gathering. Over to you, sir.
Good evening, all dear doctors. It has been around 1 year, 3 months after taking charge as a president of AFI Karkala. So we could do only 2 CME in this period, last 1.5 years. So one online CME and another one offline CME. So because of Corona, we could not do more and more CMEs in this 1 year. So now onwards, from this month onwards, we have decided to conduct 2 CME in every month till next March, till my tenure as a president finishes. We would like to continue 2 CMEs online to the members of AFI Karkala and also the members of AFI of other taluk. So just to motivate the AFI members, just to gain knowledge about clinical practice, this is our motto, to conduct 2 CMEs in every month till next March. So beginning with this, I would like to welcome today's speaker, my classmate, PG classmate, Dr. Siddhana Gowda KB, Associate Professor, SS Ayurvedic Medical College, Haveri, for this CME. Welcome you, sir.
Thank you, sir.
And also I would like to welcome all the AFI members from AFI Karkala, AFI Udupi district and other all doctors who had joined this CME. I welcome you all. And also I welcome the PG scholars and interns from the Advanced Ayurveda Medical College, Modubidre, and also from SS Ayurveda Medical College, Haveri. And also I welcome each and everybody. Thank you one and all.
Thank you, sir. Let's have a brief note on today's speaker, Dr. Siddhana Gowda. Sir have completed his BAMS and MD from STM Udupi in the year 2006 to 2015. And presently, sir is pursuing PhD from Pearl Institute of Ayurveda, Vadodara, Gujarat. And Sir has a highest scorer in Ashtanga Hridaya in first BAMS and awarded Rasavi Sharada in the year 2008. Special practice in Ayurveda, Manasaroga and Vata Vyadhi. Presently working as an assistant professor in Department of Kaya Chikitsa, SS Ayurveda Medical College, Haveri. Now it's my immense pleasure to invite today's speaker, Dr. Siddharna Gowda, to deliver a valuable information for us. We would like to hear from you, sir. Before, I kindly request all the participants to mute your audio and video for better connectivity and please to drop your queries in the chat box which will be discussed at the end of this session. Over to you, sir.
Thank you, madam, for your nice introduction. Am I audible to you?
Yes, sir.
Okay. If any network issue, just let me know, madam.
Okay, sir.
At the outset, I am very much thankful to the organizers of AFI Karkala, the president of AFI Karkala, Dr. Ravi Prasad Hegde sir, and the secretary, Dr. Bala Subramanya Achar sir, and all the office barriers of AFI Karkala, and all the student friends of Alvas Ayurvedic Medical College, Mudbidri, and all my senior doctors and student friends. With this, without wasting much time, we'll move on to my presentation. Can I share the screen, madam?
Sure, sir.
Screen is visible, madam.
PPT is not visible, sir.
Now is it visible, madam?
Yes, sir.
Visible?
Yes, sir.
Sorry for network issues. Again, I welcome you all for my presentation. Am I audible, right, madam?
Yes, sir.
Okay. The today's presentation is pertaining to the utility of Rasayana in clinical practice. Myself, Dr. Siddhanagowda KB, working as Associate Professor in the Department of Kaya Chikitsa, SS Ayurvedic Medical College and Hospital, Haveri. With the blessings of my Guru and who made me to practice in the field of Rasayana, let me seek blessings my Guru Dr. G. Srinivas Acharya sir. If you want to practice the Rasayana in the clinical practice, the first and the foremost questions which comes in our mind, the first thing will be the why to practice Rasayana, challenges in Rasayana practice, disease specific Rasayana, how to prescribe Rasayana for healthy individuals. The next comes why to practice Rasayana, the most commonly answered multiple systemic effect for, and the Rasayana can be prescribed in healthy individuals. In geriatric as well as the pediatric practice also we can practice Rasayana. Rasayana is considered to be a good immunomodulator. At present, all of you know this. During COVID-19, most of the doctors and even patients, they are running towards the Ayurveda, how to maintain the healthy state and even prevent the disorders by taking the many of the Rasayana Aushadhis. The challenges, the first, before starting any of the Rasayana, if you go with the classics, the first and the foremost, the reference from the Charaka Samhita after explaining the benefits of the Rasayana and the definition of the Rasayana. It tells about the where to, when, how to practice the Rasayana, and before starting the Rasayana, is there any the need of the Ashodhana or not? According to me, one need to consider the specific condition. Based on particular condition, if Shodhana is possible in some of the individual, then only we can go with the Shodhana. After that, one should go with the Rasayana Aushadhis. In some of the conditions, if patient is not fit for the Ashodhana, that time it is very difficulty to do the Ashodhana in individuals. That time, one can go with the Rasayana Aushadhis just with the Nitya Shodhana modalities. The next will be the practice of Rasayana should be in terms of either the Kuti Praveshika or Vata Tapika. What I am going to present today in front of you people, that is purely by the Vata Tapika Rasayana. And before starting the Rasayana, one should even consider many factors before prescribing any of the Rasayana Aushadhis. The first and the foremost, the things to consider about the Rasayana practice, the first one will be the Vaya. Text says it may be from Ashtanga Hridaya reference or even from the Shushrutas reference. Purve Vayasi Madhe Manushasya Rasayanam. That is the understanding which is available from the text. That is nothing but one should practice the Rasayana from Bala to the till the Ruddha. In the commentators they told about the for you want to practice the Rasayana in the Bala, the Matra should be the Alpa. The next should be the Prakriti. How Prakriti plays an important role in case of the Rasayana. Some of the Rasayanas which are contraindicated in some of the individuals. The best example for that will be the Ballataka. If you go with the 10 yogas of the Ballataka, most of the time it is contraindicated in the Pitta Dushti as well as the person who is having the Apitta Prakriti because of its the Tikshna as well as the Ushna Guna. Again, the next will be in terms of the Agni. All of you already know that whenever we are dealing with the disorders, most of the disorders is particularly because of the Agni. That is Sarva Roga Pijayante Mandagno. Mainly because of the Agni. If Agni is correct, then only we can prescribe most of the medicines and to act it as a proper manner. The next comes the dosage, the duration, the time of the administration of the specific Rasayana, and few of the Rasayanas are having the specific indications and even having the specific contraindications also. And whenever you go with the particular Rasayana, there is mentioning about the particular Patya as well as Apatya. These things we'll see in next slides. Before starting the practice of Rasayana and few of the Rasayanas, what I am going to deal with today. The revision from the classics, if you go with the Sushrutas reference, there who told about the Rasayana will be the Rasadi Dhatunam Apayanam Atava Beshajashritanam Rasa Veera Vipaka Prabhavanam Ayur Bala Veera Adyanam. That is nothing but the Rasayana is the one which is helpful for the Dhatu Poshana. It may be from Rasa till to the Shukra Dhatu. And the Rasayana Aushadhis are mainly acting on the Rasa, Virya, Vipaka and Prabhava. They mainly even give the good, the Ayu, Bala as well as the Virya to the individuals. And one more, the reference from the Ashushrata Sutrasthana first chapter, there he told about the Rasayana Tantram Nama, Vayahastapanam, Ayur, Meda, Balakaram, Rogapaharana Samartyam Cha. He mainly told about the Rasayana is not only for the Vayastapana, it is also acts as the Rogapaharana. That is nothing but here told Vayastapanamiti Jarapaharanam. Here Jarapaharana refers to the delaying of the Akalika Jara in individuals. It may be because of the disease condition or even because of the natural one. Next, he told about the Tarunyam Bahukalam Bahukalam Stapa Ityartaha. That is nothing but one can have the youthfulness for the many years. The next will be the few of the Rasayana varieties which are explained in their text based on the the different methods of administration and mode of the administration. The representation of the same will be in terms of the based on the mode of the method of which is used for the rasayana purpose, the vatatapika rasayana, kuti praveshika rasayana, and achara rasayana. Okay, if you administer the rasayana aushadhis and the patient is even can go with his the routine activities also. Okay, that is the vatapika rasayana. The kuti praveshika, already you know the rasayana which is practiced in an indoor manner. There is a specific kuti which is built for the rasayana purpose, and achara rasayana is the one which is daily one can practice. And based on the benefits, the Kame Rasayana and Naimitika Rasayana, the Kame Rasayana which is taken for the particular the purpose. Again we have the Ayu Kama, Meda Kama, and the Shri Kama. Here the Naimitika refers to the Vyadhihara Rasayana. The Rasayana is taken for the specific disorders, and based on the materials which is used, the Aushadha Rupa Rasayana and Ajashrika Rasayana. Here Aushadha, there are specific the Rasayana Aushadhis which are taken. Ajashrika refers to here the Nitya Kshira Gruta Bhyasanam. That is also considered to be the Rasayana in most of the individuals. The next, the Purva Karmas, before starting the Rasayana, earlier only I told, is there any need of the Ashodhana or not? The text says, Tena Shuddha Shariraya Kruta Samsarjanaya Cha Shuddha Kostam Tu Tam Jnatva Rasayanam Upacharet. The first one should compulsory go with the Shodhana. Among any of the five Panchakarmas, one should go with the Shodhana Upakrama followed by the Samsarjana. Then only we can administer the Rasayana. But the one more understanding, the Shuddha Kosa refers to after the completion of the Panchakarma, one should go with the administration of the Rasayana or the Aushadas. But according to our need, you can even based on your yukti also, we can change these modalities. Sometimes it is very difficult to plan Shodhana in some of the disease condition. The person is having the Alpa Bala and even the Vyadhi Bala is more. That time it is very difficult to plan the Shodhana. Just with the Nitya Shodhana modalities for the few days or the few weeks, we can directly start with the Rasayana Audshadis. Next, the earlier we told the many factors like Vayaha Prakurti Satmednyo Yogikam se Yad Bhavit. These are the different the understanding about the Rasayana and its the prescription consideration about their different points. Next, he told about there are 7 individuals in them. The Rasayana is contraindicated from day 1. Okay, that is the Anatmavan, Alaso, Daridraha, Pramadi, Vesani, Papakrut, and the Beshaja Apamani. There are different reasons or Madhya for the person who is not at all having the faith on the doctors. These are all constituent. Again, we have the specific contraindication according to the specific Rasayana Aushadhis. For example, you take the Lashuna Rasayana. Okay, the Lashuna Rasayana is contraindicated in the person who is having the Pitta as well as the Rakta Dusti. This is the general contraindication for the Rasayana. Already told the Vaya Prakurti Satmadno. The Vaya plays a very important role. In case of the Abala, it's very difficult to plan the Rasayana which is told in the Pravara Matra. We can only practice with and the Satmi, the Rasas. For them, we need to administer the Rasayana Aushadhis. Next, the study pattern of the Rasayanas, the 2 days study pattern of the Rasayana medicines. The first one will be the indication, the method of administration, the dosage, duration, Patya as well as the Apatya. Most of the Rasayanas which are explained in the class, but might restricted to these drugs. The first one will be the Chavana Prasha or the Bhargava Prokta Rasayana. The second, Vardhamana Pippali Rasayana. Third, Guru Rasayana or the Shilajatu Loha Rasayana. Balamula Rasayana. Guduchi Rasayana, Estimadu Rasayana, Lashuna Rasayana, and Medya Rasayana. Before starting the proper Rasayana the prescription, most of the Rasayana Aushadis, apart from the Bhargav Prokta or the Chavana Prashaleha, most of the drugs are available in the form of the cellulose capsule. That's why the Ayurvedic capsules are also called as the vegetarian or cellulose capsules or vegan capsules. These are made from the fibrous plants in which the specific amount of drug which is uh, filled in the form of the powder. Next, like the gelatin capsules, the resulting capsules are tasteless, odorless, and even the colorless also. The Chawanaprasha, all of you know that, and most of the even patient themselves go on consuming the Chawanaprasha from the medical shop itself. But the classic says regarding the indication about the Chawanaprasha leha, Kshinakshatanam, Ruddhanam, Balanam Changavardhanaha, Swarakshaya Urorogam, Rudrogam, Vata Shonitam. Try to understand the rationality behind the prescription of this Bhargav Prokta or Chawanaprasha leha. Almost all the individuals in which there is a dominantly the involvement of the vata dosha and even the rasa along rasa dhatu, along with there will be the dhatu kshaya. In that condition, this rasayana is very good helpful. Next, the dosage of this rasayana will be the oral, the administration of this. You can give the 15 to the 40. They usually, in case of their children, the 1 to 2 teaspoon up to from 5 to 10 years of age. In adults, we can practice up to the 48 gram, 1 pala pramana of Chavanaprashaleha, early morning empty stomach with kshira. This is the best tolerable dose in adult individuals. The next rasayana will be the Vardhamana Pippali rasayana. If you go with the Charakas reference, the Vardhamana Pippal is mainly indicated in the Pranavashroto Vikara, mainly Swasa, Kasa, Penasa, Vata Rakta, Amavata, and Arbuda. Okay, mainly the Kapha dominant conditions where there is a presence of the Kapha. There it is better to go with the Pippal route. This is in the form of the Vardhamana prescription. The first day, the 2 capsules, the second day, 4 capsules, third day, 6 capsules. It is nothing but every day one need to increase the two capsules up to the first 10 days. Next, again taper the dose from 11th day onwards till to the 20th day. Okay, the duration of this rasayana will be the 20 days. The patya during this rasayana, the kshira and the sestika shali, apatya, the atapa sevana, and even the vidahi ahara should be avoided. I had the interesting case which is presented with the involvement of the pranava shrotas. A boy aged about 12 years, not a known case of diabetes mellitus and hypertension, as apparently normal 6 months back, gradually started developing the presentations in terms of the sneezing, running nose associated with cough. He consulted many doctors, but later come to our hospital. He given only with the Chavana Prashaleha, 2 teaspoon early morning, empty stomach, and Capipali Rasayana, 1 capsule twice a day after food. He got almost the tremendous results in a span of 1 month. The next comes the Guru Rasayana. It is also known as the Shilajit Roha Rasayana. It is a peculiar preparation which is done by our Guru Dr. G. Srinivas Acharya sir in the name of his father. He formulated this, the Rasayana, that's why he kept this name. The most commonly the Shilajit Rasayana. If you go with the Charakas reference in the Rasayana chapter, he told, Naso asti rogo bhuvi sadhya rupaha shilavayam yamna jayat prasaya. It is nothing but the disorder if it is not cured by the prescription of the Shilajatu. It is never cured by any of the medication. This is the understanding he told. But it is not so in all the conditions. This is one of the ad technique which is followed in the Ayurveda to attract about the readers, particularly in the chapter of the Rasayana. If you go with the indications of this Silajatu Loha Rasana, almost again he told about the conditions where there is an involvement of the Kapha as well as the Medo Dusti. If you go with the Prameha, this is comes to be again the Kapha Pradhana Tridosha Javadi, the Vata Rakta. It is mainly if it is involvement of the Kapha and the Ameda, most of the time and Staula. Try to understand here that is the disorder where there is a presence of the Avarna or Kapha Medo Dusti. There better to go with the prescription of the Guru Rasayana. The method of administration of this Rasayana will be the oral route. It is available in the form of capsules. 12 capsule. If you want to follow the Rasayana dosage, just follow the 12 capsule early morning empty stomach with hot water for 15 days. Otherwise, if you want to follow the Shamana dosage pattern, just go with the two based on your need and the patient, the economic state, either 1 TID or 2 TID. Even we can do the modulations in the dosage also, or half of this the Rasayana dosage, like the 6 capsules once in a day, or divided dose. The 6 capsule is divided into 3 times per day. That also can be followed, but most of the time we better to follow the Rasayana dosage if patient want to achieve the desired Rasayana effect. And Patya here, the specification about Patya, the Vidahi, Abhishanda and the Kulata has to be avoided in this condition. The, the case, I had the case who presented with the presentations of the Vata Rakta, the male patient, the middle-aged male patient had a history of the pain in the lower limb, which is associated with the blackish discoloration. This patient had the referred to the surgery, but patient himself refused for the surgery. Later come to our hospital and given the prescription of Guru Rasayana for the 2 months. The patient relieved with the blackish discoloration as well as even the pain in the lower limb. The next comes the Guduchi Rasayana. All of you know that the Guduchi is the most abundantly used drug, and all of us know that it is day one itself is considered to be a best drug for the Rasayana. If you go with the Sharangada reference, there he told Rasayanam cha tadneyam ejjara vadinashanam amruta rudantischa guguluscha haritaki. These are the few of the drugs which are dominantly used in many of the conditions. They mainly acts as the Rasayana. And if you go with the later authors, the Guduchi is considered to be a best, the Jwaragna drug. It's having given the synonyms like the Amruta and all. It's mainly because of the wide application of this drug in many of the conditions. It is mainly because of the wide application of this drug in many of the Susti and Vata Rakta, Vata as well as the Rakta Dushti, and even the Prameha, Kamala, and Pandu. In all these conditions, it is indicated the administration of Rasayana purpose, the 12 capsule early morning empty stomach for 15 days. The Patya, there is no specific Patya which is mentioned, but general the Patya as well as Apatya which is mentioned, we can follow the avoiding of the Viday and the Guru Bhojana. That has to be adopted. The one, the peculiar, the case which presented with the on and off fever and multiple joint pain. This patient consulted the doctors, later came to the our hospital, just given the Guduchi Rasayana, the capsule of Guduchi Rasayana, 2 capsules thrice a day after food is given for the 1 month. Patient is almost asymptomatic at present. The next, the Estimadu, the Rasayana. Okay, all of you know that the Estimadu, there is considered to be an best Rasayana in most of the condition where the presence of the Pitta, Dusti, and even the individual having again the Balaksha and Dhatuksha. That's why the Tamakaswasa, it is indication of the Estimadu Rasayana is Tamakaswasa, Amla Pitta, Shita Pitta, Dhatuksha the Vata Vadi, Karsha, and Palita and the Kalitya. The dosage of this rasayana, the mode of administration is the oral route. It is a course of the 30 days. The first day, the 4 capsule early morning, empty stomach. The second day, 8 capsules. Third day, 12 capsules. And fourth day, 16 capsules. From day 1 to the day 4, every day one need to increase 4 capsules in every day. And on fourth day, it becomes the 16th capsule. The same dosage, the 16 capsules should be followed for the 30 days. The specific patya during this rasayana will be the Kshira Bhojana. I had the interesting case. The boy aged about 12 years. He had the patchy hair loss over the scalp as well as eyebrow, which is associated with the itching. Clinically, this case the diagnosed as the Indralupta. Okay, and he had a same this complaints from past 1.5 years. He consulted doctors in KMC Manipal as well as the Sirsi. Just if you go with the Palashruti of the Justimadu Rasayana, there he used the word the Kesha as well as the Chakshusha. By taking the reference of Kesha, the for Indralipta case, I just given along with the Krimihara line of treatment, Gandhaka Rasayana tablet, DS, one tablet twice a day after food, given the Justimadu Rasayana, one capsule twice a day after food, and just the application of the Ichabedi Rasa and Krimikutar Rasa over the scalp with Nimbusa Rasa. This patient had a tremendous results. Almost he left the medications. If you see this picture, this is the before treatment. When he came to our hospital, this is the hair loss which is seen in the scalp, and after the complete the treatment, the 2 months course of the same medications, the patient this much improvement which is seen. The next, the Balamula, the Rasayana. The most commonly again, the Bala is considered to be a best drug for the Balya and the Brahmana purpose. The disease in which the dominantly involvement of the Vata presentation or Vata dosha dusti. There we can go with the prescription of the Balamula Rasayana. The main indication of Balamula Rasayana is the Pakshagata, Grudrasi, Kshatakshina and the Karsha. The mode of administration of this Rasayana is the oral route. The dosage of this rasayana is 2 capsules thrice a day after food. The duration of this rasayana is 1 month, and the specific pathya in this rasayana is the usage of the akshira and the shashtika shali. Ada one, the female patient aged about 40 years, she came to me with the history of giddiness and associated with the altered consciousness for few minutes. But this case is ruled out with the presentations of the apasmara. She doesn't have any the vega of the apasmara. Just she presented with the presentations of the Brahma, just chakra arudamiya. Whenever she tried to get up from the bed, whenever she tried to walk that time, she had the giddiness that is reeling in nature. That patient is just prescribed on the OPD basis, just with the Balamola capsules, 2 capsules twice a day after food for the 2 months. Patient got the result, the complete the relief from the giddiness as well as the altered consciousness in a span of 2 months. The next, the one more, the Rasayana, which is used abundantly in our hospital, that is the Lashuna Rasayana. If you go with the reference of this Lashuna Rasayana is from the Ashtanga Hridaya, the Rasayana chapter. There he told about the indication of the Lashuna Rasayana, Vata Vyadhi mainly. Among the Vata Vyadhi, again the pain dominant presentations like the Katishula, Grudrasi and the Vishwachi. One need to consider the specific the contraindication for the Lashuna Rasayana, where there is a Pitta as well as the Rakta Dusti, Sarana Avaranam Pitta Raktadau. There it is contraindicated. One should not prescribe the Lashuna in case of the Pitta as well as the Rakta Dusti, because it is the very Tikshna in nature. Again, the chances of the worsening of the condition. The mode of administration of this Rasayana will be the oral route. The dosage pattern, the classical dosage of the Lashurna Rasayana will be the Uttama Matra is the 1 Kudava Pramana, and the Madhyama Matra of that will be 1 Pala Pramana, and next one will be the half of that, the 2 Karsha is the Avara Matra. The SDM has formulating this rasayana in the form of the dried freeze powder of the Lashuna. Each weighs about the 500 milligram. The first day to the fourth day. Every fourth day, one need to increase the 12 capsule. From first day to the fourth day, 12 capsule early morning, empty stomach with milk. From fifth to the eighth day, 24 capsule early morning, empty stomach with milk. From ninth day to the 12th day, 36 capsule early morning, empty stomach with milk. From 13th to 16th day, 48 capsule early morning, empty stomach. The duration of this rasayana is 17 days. After the administration of the Rasuna Rasayana, few of the patient experiences the burning sensation in their chest and even the Sarvanga Daha, also the possibility. It causes the Pitta Prakopa in individuals. That's why one should go with the prescription of the Virechana on the 17th day. Just the single day on 17th morning, early morning, empty stomach around 6 to 8 a.m. Better to go with the prescription of the 10 to 15 grams of Srivrut Leha just for the Pitta Shamana action and the Virechana. The specific Patya which is one need to follow in the Lashuna Rasayana always Try to avoid the Atapa Sevana exposure to the sunlight and the Tikshna Ushna Ahara, and better to take the Akshira as the Patya in case of the Lashuna Rasayana. I had a one, the case who present the 20 years, the male patient, not a known case of diabetes and mellitus hypertension was apparently normal the 6 months back. Gradually started with the pain in the lower lumbar vertebra and radiating to the right, the leg. This case clinically diagnosed as the Vata Pradhanaja, the Grudrasi. Just given with the classical dosage of the Lashuna, what I explained earlier, the patient got the 80% result in a span of after completion of this the Rashuna Rasayana. Okay, till he is asymptomatic, only he is maintaining with the 2 BD dosage of the Lashuna Rasayana. The next, at last, after hearing the session, one should remember most of the Rasayana Aushadhis for our clinical practice. That's why the Charaka has told the few of the made the Rasayanas. It is indeed of the hour at present. The most of the individuals are having the psychosomatic presentations. They're better to go with the prescription of the few of the made the Rasayanas. Charaka has highlighted the poor made the Rasayana, that is Manduka Parani, Estimadu, Puduchi, and the Shankapushpi. It is not only doing the action on the Medya, it is even do the Bala Agni Varna and Suravardhana also. The one, the capsule which is the tablet form, the single drug from the Himalaya Drug Company, which is available in a 250 mg. Here it's not the capsule, it is tablet form. The indication of the Medya Rasayana is the Unmada, Apasmara, Madatya, Chittodvega, and Nidranasa. In my clinical practice, I am abundantly using this in case of the Madatya, Chittodvega, as well as the Nidranasha. This rasayana is given the orally 2 tablets twice a day after food, and there is no specific duration about the a few of the rasayana. From based on your yukti, you need to decide the duration till the Vadi Shamana action. The Patya here, better to go with either the Kshira or the Gruta. The next will be in terms of the Apatya, Guru Snigdha, Ahara has to be avoided. The one case I had the presented with the generalized anxiety disorder or the Chittodvega, what we consider a male patient who presented with the chest pain, difficulty in breathing, the palpitation, burning sensation in the chest, which is associated with the sore belching and the appetite. For this complaint, the patient consulted a nearby doctors. Later, his sister itself is the Ayurveda doctor. She referred that doctor to the cardiologist at Hubli. They had done almost the ECG as well as the echocardiography, the investigation pertaining to the cardiovascular system. All were within normal limit. The doctor himself diagnosed him as the anxiety disorder or the phobic disorder. He just given the anxiolytics and the the drugs which are given for the sedation purpose. The most commonly they are given the tablet petril beta. One, it is the combination of the clonazepam as well as the propranolol during night hours, and one more drug. He had the palpitation and even the tremors. For that, they given the metoprolol, a beta blocker, that is during the morning hours after the food. This patient not relieved with any of the symptomatology after consuming these many medications, petrol beta as well as the metoprolol. He took these medications for more than 2 months. Later, by the advice of his friend, he come to our hospital, just prescribed with this Brahmivati, the tablet, the Brahmivati for the 1 month, the 2 BD dosage after food. The patient was almost relieved with their symptomatology after the 1 month of the medications. Again, he continued the medication for the another 1 month. Okay, after seeing these Rasayana, one should know about the how our Rasayana Aushadhis are going to act, the mode of the Rasayana Aushadhi. If we prescribe any of the Rasayana, it may be the Ahara Rupi Rasayana or Aushadhi Rupi Rasayana or among whatever the classification which is explained earlier. It acts as the best the Rasa. It do the Uttara, the Dhatu Poshana, and it impacts on the Agni as well as the Shrotas. For example, I told best example for the Vata involved, the Shrotas, the Lashana Rasayana, the Avarana pathology, the Guru Rasayana. It clears the involved, the Shroto Avaroda, and even improves the Uttarottara Dhatu Poshana just by improving the quality of the Dhatus. By this, one can achieve the Dirgayu and even the good, the Vedic Shamatva. Not only this, by prescribing even some of the other, or the whatever the prescription we have from the earlier list, even it acts on the Manavashrotas or even Medya also. Finally, it will do the rejuvenation for us. That is the final action of the most of the Rasayana Aushadis. Okay, here we come to the end of the presentation. The Rasayana is considered to be the unique treatment modality which is explained in the Ayurveda. The selection of the Rasayana Dravya purely depends on the many factors. Before prescribing any of these, the Rasayana Aushadis, one need to consider earlier factors like the Vaya, Prakriti, Satmya, and even the bala of the patients. Based on that, one and agni of the patient also. Based on that, select the particular the rasayana aushadis. Try to adopt the rasayana as a treatment protocol in your clinical practice along with the other the drugs. If rasayana treatment is practiced according to the classics, it give all the desired effects. With this, I end my presentation. Participants, if they have any queries, they can ask. This is open for the discussion.
Thank you, sir, for your valuable information with clinical experience. Uh, Now, I would like all the participants to put your queries in the chat box, which will be discussed now.
Yeah, am I audible, right, Panjashri madam?
Yes, sir.
Can I stop screen sharing?
Okay, sir. If anyone have their queries, please to put it in the chat box.
Doctors can unmute yourself and ask question. No problem.
Sir, can we put these rasayanas along with the kashayas also?
Yes, sir, definitely, sir.
Yeah.
In Vatarakta condition, along with Guru Rasayana, and even you can go with the kashayas like Mahamanjishtadi Kada and all. Okay, disease specific kashayas also we can practice along with the specific disease.
Yeah. Now, for back pain and grudrasi, we can put the Dhanvantara and Sahacharadi Kasha. Along with that, we can also
Yes,
give
sir.
this.
Yes, sir. Yes, sir. Definitely, sir.
Yeah. Yeah. Thank you, sir.
Doctor, in Gridrasi, shall we use Lashuna Rasayana?
Yes, madam.
Where pain is predominant, Vata predominant.
Yes, madam. In case of Kevala Vataja condition, the Kevala Vataja Grudrasi, the Lashuna is having very good result. I am using in that condition.
Okay. Thank you, doctor.
Okay, madam.
And in autoimmune cellulitis, Vatarakta.
Yes, madam. Yes, madam. Better to go with some of the individuals if the skin is involved. Better to go with the Bakuchi Rasayana or the pain dominant presentation. You go with this one. Okay, Valamula Rasayana. If Pitta Dushti is there, select again the drug which is having the Pitta Shamana action. Like that, we can combine even other Rasayanas also. It is not hard and fast rules that those the only single Rasayana we can use in multiple conditions.
Okay. Thank you, doctor.
Doctor, having one question.
Yes, sir. Yes, sir.
Hi, first. Okay.
Yes, sir. Yes, sir. I am very familiar with you, sir.
Yeah. Thank you. Thank you. Okay, I'm having one question.
Yes, sir.
Can we use any, if a condition comes, any two types of rasayana in one particular patient together?
Yeah, good question.
Yes, yes. But I am not using, sir. But we can use. But it is very means most of the time it is difficulty to prescribe single rasayana or
Right.
to combined rasayana in a single individuals. For example, if you planning the rasayana aushadha, particularly a lashuna is very Tikshna and Ushna. If you because even dosage is also 12, 24, 36, and 48. In that condition, better to avoid. If you are only for the using for the purpose of the shamana purpose, or even the dose which has to be reduced, like the 2 TID or 1 TID, according to your convenience also we can use. But in a two rasayanas in a single condition and single individual, it's very difficult to use, sir. Till now, I am not
Because
using that also.
okay, sir. Because usually one rasayan itself having
Yes, sir.
Vardhaman, Yoga, and yeah.
Yes, sir.
And one more question is minimum what should be the age to
Usually,
start a rasayana?
usually text says the purve vayasim manusasyam rasayanam. Okay, that is the understanding. But if you go with the later authors, we can start rasayana from the 1 year onwards in a alpa matra. Okay, you need to decide their dosage according to the age of that particular individual.
Okay, because in few condition comes like a cerebral palsy, like a few very early age in the 3 years, 4 years like that. I think according to dosage and
Yes,
desham,
sir.
dusham, balam, kalam, manalam, prakriti, maya, all those looking at
Yes,
it,
sir.
later we
Yes,
can
sir.
decide.
Yes,
Okay,
sir. Definitely.
okay, thank you. Okay, sir.
Hello, hi.
Hi,
I'm
sir.
myself, Dr. Deepak. Hi.
Yes, sir. Yes, sir. Yes,
I'm working in the health department. Yeah, now to prevent the third wave, we are
yes, sir.
conducting a lot of camps where we go to each and every school and check up lot of screen children for the purpose.
Yes, sir.
So to prevent the third wave, can we use rasayanas? Like there are many people who come with me and discuss the same thing, like whether we can go for Ayurveda or any other thing. So I want the clarification that in this case, like to prevent the third wave of like they say, it may affect the children the most. So, how can I guide the children or the parents who come for me with the help of rasayanas or any other medications which can be indicated in this situation? Thank you.
Yes, sir. Yes, sir. It's a very nice question. Here we are planning for they just we are giving with most of the cases who presents with the patient immunocompromised cases. We can use the Guduchi Rasayana above 10 years. We can use the one capsule twice a day after food, and even in the form of the supplements. Better go with the either the Bargo Procta Rasayana or the Swamla compound. That also very good. We can use the 1 teaspoon early morning empty stomach. That is having very good result, and I am using in most of the cases. That is having
Okay.
very good result, sir. We can
Okay.
implement that also with
Okay.
standard dosage protocol. From about 10 years, we can use the Guduchi capsule, one capsule twice a day, and even the Bargo Proctorasana, 1 teaspoon twice a day after food or early morning empty stomach. That you
Okay.
can implement, sir. Definitely, it is having very good result.
Okay. Okay. Thank you. Thank you, sir.
Thank you, sir.
Sir, another one question.
Yes, sir.
Sir, if we are using Guru Rasayana or Lashun Rasayana,
Yes, sir.
on that time it is a pitta is aggravating.
In case of Lashana Rasayana, sir, it is.
Yeah, Lashun Rasayana.
Yes,
Okay,
sir.
that time we can give Grita.
Usually better to supplement with Kshira and Sestika Shali Bhojana, sir. That is enough to enhance that effect. That is enough.
No. It is in just shamana therapy. We are giving the just capsule.
Yes, sir.
If it is one BD oral,
Yes, sir.
on that time that we can give gritas as
But
a
I
shamana aushadis.
but I am not using Sir Gruta, but only just by Shamana dosage it doesn't occur at all. If you're only planning for the Rasayana
Okay.
dosage, then only patient will
Okay.
get all these symptoms. And
Okay.
even 2 TID also doesn't causes any burning sensation and all patient.
Okay, sir. Thank you.
Thank you, sir. Now I would like to invite Dr. Balasubramanya Acharya, sir, for vote of thanks. Over to you, sir.
Yeah, thank you. First of all, I congratulate Siddhanagowda. Thank you very much. After a long time, this was the opportunity because of this online session. We could meet at least by this way.
Yes, sir.
Because for other doctors, he was my junior in UG
Yes,
days.
yes, sir.
So very well, I know him personally also. Thank you very much for your deep and understandable this session. Thank you very much. And one more thing is, long ago we had such Rasayana Kalpa. This one in our AFI Karkala itself, here in Karkala, our Acharya sir, Srinivas Acharya sir itself conducted that one. So once again, we are glad and we are happy to receive the same through his Shisha only. That is why we are very happy, and it is a really knowledgeable session. Thank you very much, Siddhanagowda sir, and other our AFI members and President Ravi Prasad sir, and all the team members, and thank you for our Google Meet app also, because of that app we could meet in this online session, isn't it? So for all of you, thank you very much, and thank you once again.
We are very much thankful to Dr. Ravi Prasad sir and Subramanya sir and all the office barriers of AFI Karkala. Thank you, sir. Thank you, one and all.
Here we are at the end of the session. Thank you for everyone.
Thank you.